We should brush our teeth twice a day, in the morning and in the evening, and we should floss at least once a day. The main mistakes that most of my patients make seem to be that they rinse their mouth out after brushing their teeth, or they use floss in an incorrect way, or another one is they brush their teeth with an electric brush but they use it as if it's a manual, so they're moving it around all the time, or they use a hard bristled toothbrush side to side, which isn't very good for the gums. So the reason why flossing is so important is because even if we're the best toothbrusher in the world, we only can get up to 60% of the bacteria. So the rest is 40% that we leave in between the teeth. And if we leave this bacteria over time, it can cause gum disease, which is called periodontitis clinically, which basically can result in tooth loss over time. Usually when people floss or brush and they have bleeding, it usually means that the gums are inflamed, which means there's bacteria there. So keep flossing and keep brushing, and you might need to visit your dentist. Make sure you're coming twice a year for your cleanings as well. It's kind of hard to say exactly like what toothbrush is the best, because every patient is different, every mouth is different. But in a general healthy mouth, I would usually say an electric toothbrush, for example, Oral-B or Philips. But if you're unsure, please check with your dentist, because everyone is different. Of course. So first, the electric toothbrush. So the way that we want to use this is we don't want to use it like a manual. So what you're going to do is you're going to pop it onto the tooth, one tooth at a time, and put a tiny bit of pressure and then turn it on. Leave it there for about 4 seconds and then move on to the next tooth. So for the manual toothbrush, what we want is a nice soft or medium brush. And what you want to do is you want to place it 2 teeth at a time, little circular motion, so that the bristles are splaying underneath the gum line. So we get a nice clean, and then we move on to the next 2 teeth. So for the floss, what you want to do is you want to wrap it around your 2 middle or index fingers like this, so that you have good control. And then what you want to do is you want to slide it down. You might hear like a little snap, and then bring it one way this way, and then to the other side. So like a C shape, and then back up. You don't want to snap it down straight onto the gum and back up. So another alternative to flossing are these little interdental brushes. They're quite handy, so basically you just in between the teeth, in between all the teeth once a day. But the thing with these, they come in different sizes for different spaces. So if you're unsure on what sizes you might be, you can get it checked with your dentist or hygienist.